Hello and welcome. This week we are going to discuss the details involved with reporting. Okay, let's try this again. Okay, let's try this again. Technology, a blessing and a curse. All right. So, as I was saying, this week we're going to discuss how to code services provided to an inpatient. Remember, ICD-10 PCS is inpatient only. So this pregnant patient, has been admitted into the hospital. But as you all may know, should know certainly, that an obstetrician treats a pregnant woman, a whole pregnant woman. However, we only report services provided to this pregnant woman in a hospital when the physician is actually caring for the products of conception. Okay? So, the products of conception, the fetus, the umbilical cord, the placenta, the amniotic fluid, and a bunch of other tissue and stuff like that. Okay? This is the most challenging chapter of PCS because you have to psychologically separate services provided to the woman from services provided to the products of conception. Only treatment to the products of conception are reported from this chapter of ICD-10 PCS. Okay? And that it can be complicated when a physician is treating a pregnant woman because there may be other services involved while this woman is in the hospital. It's not the pregnant woman, it's the products of conception. Only what happens to Mr. Spermy and Miss Egg get together, make a little zygote, go down to the uterus, and set up home. Okay? Only that. The rest of the body is reported most often with a med-surg chapter and maybe other chapters as well. Okay? So I recommend a little post-it note or a cheat sheet or something to remind you of this limitation on this chapter. Okay? All right. So let's take a look at what is involved. The root operation terms 2, 4, no, 3, 6, 9, 10, 11, 12. 12 root operation terms. You know, you don't have to memorize them because your coding manual is going to explain it to you. Okay? But I thought there are a couple in particular here that we should review to help you get started on the right foot. Okay, so let's go through these. This is 102, the table for 102, and you will notice that you don't have to make many decisions with regard to reporting a change, but look carefully at this root operation terms definition. Taking out or off a device from a body part. But remember, in this case, for this chapter, the body part is, you'll only have one body part. Well, products of conception, okay? and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. So this most often is going to be the changing out of a monitor, a fetal monitor, not a heart monitor for mommy, not a blood pressure monitor for mommy, a fetal monitor. Now, you'll notice that, as I said, you don't have very many decisions to make in reporting this. It has to be a swap out of the device, 10207. It's going in the vagina. And the device is the only place where you have to make a decision based on what is documented. A monitoring electrode, which is the most typical, but remember that things in healthcare, especially caring for our next generation, if you will, in utero, for caring for the pregnant woman, there's always room for growth and new innovation to have potential. So we have other device so that we can be sure that if something new gets approved in the meantime, you have a way to report it and there will be no qualifier. Okay? All right. Any questions with regard to change as your root operation term in this obstetrics section? Okay, email me if you come up with any. All right, this is a very, very common procedure that can be performed on a pregnant woman who has been admitted to the hospital. Drainage, and that is taking or letting out fluids or gases from a body part. What's the body part? The body part is the uterus, because that's where all of the products of conception are housed, if you will. All right, so the important thing here is you may know that they can take a sampling of the amniotic fluid, could be for genetic testing. There can be several purposes for doing this amniocentesis. That's the word that you're familiar with if you are. Amniocentesis is when they extract amniotic fluid from the pregnant womb. Okay, so there are lots of different approaches. You already know the approaches, but what I want to call your attention to is the qualifier for this particular code. And that is, you'll notice that there are two different letters available for your 7th character that mention amniotic fluid. Okay, therapeutic and diagnostic. Okay, so if a woman is having an amniocentesis to investigate the to see if they're going to do genetic testing or just to make sure the baby is okay, that's diagnostic. That's your most common amniocentesis, and that then okay. We'll talk about the tongue in the digestive system. Okay, so your code will then end with the letter U in the 7th character position, amniotic fluid diagnostic, if they are doing the amniocentesis to make sure that the baby is healthy. Okay. However, you need to be aware, if you're not already, that there are also times when they will remove amniotic fluid because there is too much fluid in the womb. That would be then therapeutic. Ending this code with the letter C, amniotic fluid therapeutic, as opposed to diagnostic. Remember, therapeutic means to make better, to heal, to fix. Whereas diagnostic is, let's take a look at the genes, at the cells, what's going on in here. Okay. Now, there may be cases, of course, where they may be taking out fetal blood, cerebrospinal fluid from the fetus, other type of fluid. That would be, of course, necessary to be specified in the documentation. Okay, so you got to keep your eye out and read this carefully. Never, 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 never assume. Okay, and I don't want you to be fooled by the term drainage, because we're not taking out all of the amniotic fluid. We're not taking out all of the whatever liquid fluid. All right, it's typically a sampling for further testing or whatever purpose. Okay, make sense? All righty then. Okay, next we have, this is not about Roe versus Wade or the Supreme Court. These things happen. It happens. It's just, remember, you have to leave any political questions you have at the threshold of the hospital where you're working. Okay? Your job is to report what went on without any politics. So you're going to read the documentation, and you'll notice here that you may have two decisions to make. First of all, might be an alternate approach to the natural or artificial opening. Okay, so maybe endoscopic, maybe open, percutaneous, endoscopic, All right, that's on row 1, no device, no qualifier. Or products of conception using a different qualifier, which will identify what was used. Okay, vacuum, laminaria, abortifacient, fastened, or no qualifier. And again, the documentation should specify this. If not, what you're going to do? You're going to query the physician and get the documentation complete so that you can complete this code. Remember, there is no such thing as an unspecified code in ICD-10 PCS. Also remember that querying the doctor is a legal obligation of your job. This is not, oh, I'm too stupid to be able to understand. This is, in order for me to do a proper legal job, I must have all the details. And remember that physicians do not take coding classes in medical school. They have no idea which details are important to the coder and which make no difference. We are part of a team together with the physician. Together. Okay? All right. Next, extraction. Okay, ladies and gentlemen, what we have here is most often going to be what is known commonly as a C-section. Okay. All right. So if they write C-section, that means they're extracting the baby from the mommy. So then we're on our first row, 10D as in dog, extraction, products of conception, open, because you are cutting that baby open. Okay, no device, but you must look at the documentation to identify where the incision was done. For example, what is known as a bikini C-section is most often considered a low cut. That would be a 7th character of 1. Okay, if you are not clear on your first day or the first time you have to code a C-section for this physician, then just ask him and write down the answers, and then you never have to ask him again. Okay, you see how that works? Okay, now the second row, products of conception, extracting the products of conception via a natural or artificial opening. Remember, we talked about that, referring to a stoma. You're not pulling a baby out through a stoma. So this is going to be a vaginal ejection, or a delivery. Okay. But here's what I want you to notice. Okay. This is an assisted delivery. This is not where the doctor just sits there at the bottom of the table with a catcher's mitt waiting for the baby to come shooting out of the vagina. Okay, that would be the express path. All right, sometimes the doctor has to use forceps to pull the baby out. Sometimes they attach a little suction cup and vacuum out from the head. Okay, an internal version means that the baby may be in the wrong position to deliver properly, so they may have to go in there and reposition the baby. Okay, so line 1 on this extraction table refers to a C-section, but line 2 does not. That's a vaginal delivery with assistance, where the doctor actually has to work to get the baby out. Okay? All right. Now, the third row on this table is the number 1, and you'll notice products of conception retained. Now, there are times when a woman may give birth and does not end up passing the placenta or some fluid or something like that. Okay, there are parts left inside. Okay, now some of you may know the term D&C, dilation and curettage. So they may do that, okay? But they are going in. This is a woman who was pregnant, has given birth, but there are still retained products of conception. There's still stuff in there that can cause infection and a terrible situation for the mother. So they have to go in there and get it out, okay? And then the fourth row on this extraction table reports products of conception ectopic. Now, some of you may have heard that term before, an ectopic pregnancy. What it means is that, you remember, okay, Mr. Sperm and Miss Egg get together and the nightclub is in the fallopian tube, okay? They get together, they make a zygote. The zygote is then supposed to continue the path of the fallopian tube into the uterus and build a nice little camping ground in the wall of the uterus, okay? But sometimes the zygote likes to party on and stays in the fallopian tube. This is a problem. The fallopian tube is this little tiny tube. It's only 4 inches long, and it's a tube. It cannot grow an entire baby. So if it's stuck and it stays there, that is known as an ectopic pregnancy, which basically the word ectopic means outside of where it's supposed to be in the uterus, outside of the uterus. If that baby starts to grow in the fallopian tube, we're going to have big trouble, Mr. or Miss or Mrs. Lady. Okay. So they have to surgically remove, or the woman could possibly die. Bad. Okay. So this is the removal of that zygote who stayed too long at the fair and didn't go home into the uterus like it's supposed to. Okay. All right. That's a lot going on for this one table in the obstetric section, don't you think? I know. I know. Okay. All right. Next, we have delivery. And this is going to be the passage of the products of conception, known as a fetus, passing through the genital canal. Isn't that a nice way to say vagina? Okay, so it comes down the vagina. The doctor is standing there with his catcher's mitt. Okay, he could help a little bit, but not too much. Okay, you'll notice that if this is exactly what is documented in the physician's notes, you have no decisions to make at all, because it's 1, 0, E, 0, X, Z, Z. Okay. And you'll notice the approach is external, because you're waiting for the products of conception, the baby, followed by the umbilical cord. Well, the umbilical cord kind of comes attached, but then you have the placenta and anything else going on inside there. All has to come out. Okay. All right. So, piece of cake, delivering this natural birth, also known as a vaginal birth, because the baby is right. Okay. That's nice and simple. All right. The next table in this section is the insertion table. Now, we are not talking about the insertion of the sperm. This is talking about a device that is being inserted. And you'll notice in the description, monitors, assists, performs, or prevents a physiological function, but does not physically take the place of a body part. Okay. Again, we are looking at most often the placement of a monitoring electrode. Can be something else. You need to read the documentation carefully and speak with the physician. You need to have a good relationship with these physicians for whom you are coding. And I don't mean relationship like you go out for drinks or pizza or whatever. I mean, you have to feel comfortable querying them, talking to them, let them educate. When you write this, what do you mean? So you know, for on and on and on. Okay. And here, the other decision you have to make or determine from the documentation is, was it an open approach or vaginal? Okay. All right. We are cooking here. Inspection is the next root operation term in this section. And again, we have 3 choices in the body parts, but notice they all begin with products of conception. This is I spy with my little eye what? Okay, so they're going to visualize the products of conception and make sure everything is okay, or they may make sure that, oh, yes, the reason why this woman postpartum after the birth is having a pain or having a fever is there are still retained products of conception, or perhaps this is an ectopic pregnancy. They're going to go in and take a look. Okay. Pretty straightforward. But again, must be focused on products of conception? Fetus, umbilical cord, placenta, amniotic fluid, whatever else is going on in there. Okay, but only that. Only what happened after Mr. Sperm and Miss Egg got together. All right, next is removal. Now, again, do not confuse this. This is not an abortion. This is not an assisted delivery. This is only involved with a device. So at some point, you should have previously coded the insertion of this device, and now you're going to remove it. Okay. Again, most often a monitoring electrode, but we do not assume it's got to be documented. Okay. If it's not documented, it didn't happen. If it didn't happen, you can't code it. Everybody knows that. All right. Next, we have repair. Okay. Now, again, this is, I honestly believe this is one of the most fascinating and incredible aspects of healthcare in the United States. Maybe other places, but I know about the United States. Okay. This is the ability to therapeutically correct something that is wrong with the fetus while it is in utero. So they can fix it before the baby is born, and then the baby can be born most often perfect. Okay. Now, one of the procedures that I know of most definitely is the correction of spina bifida, which is absolutely incredible, that they can identify that a baby has spina bifida in utero, and they can go in and they can close up the hole. And the baby can continue growing normally and have a good chance of being born with the ability to walk, it's just fascinating. And of course, there are other procedures that can be done in utero. So this might be a wonderful way for you to find out where, when you're coding for obstetrics in a particular hospital, especially if it's a specialty hospital, and find out what they are doing, because it is incredible. Okay, so that's what this is. All right, next we have repositioning. Moving to its normal location or other suitable location, all or a portion of a body part. Now, our body parts are products of conception, right? So this may be the physician repositioning a baby in utero so the baby can be born vaginally head first like they're supposed to. Okay. It may be repositioning a shoulder or something else. And it may also involve, again, an ectopic pregnancy. I am not up on this, but this leads me to believe that there's a possibility that if the zygote is still small enough, they might be able to push that baby down through the fallopian tube and implant it in the wall of the uterus. Okay. And then we can have a baby instead of a problem in the fallopian tube. Okay. All right. If you don't know, you need to talk to the physician, the attending physician. All right. Resection. You know that a resection is cutting out or off. Okay. Well, Zoom Evidently, Zoom was having too much fun over the holiday weekend. That's all I can say. All right, so resection. You know that this is the cutting out or off all without replacement all of a body part. And notice you only have one choice for the body part, and that is an ectopic pregnancy. Basically, this is going to be a salpingectomy. Remember, salping, fallopian tube, ectomy, surgically removing. A salpingectomy being performed because of an ectopic pregnancy. This is not a regular old, we're going to do a hysterectomy on this woman and remove the fallopian tubes also. This is specifically removing the fallopian tube, a salpingectomy, because there's a zygote stuck. Okay? All right. And the last is transplantation. Now, this is not a reference to IVF, in vitro fertilization. In vitro fertilization is the transplantation of a zygote into a woman's uterus. You'll notice that the qualifiers don't fit with that concept because the qualifiers here only have to do with body systems. Now, of course, you can't transplant an entire nervous system, but there might be something in particular that is going to be done. And remember, this must be in utero, because we are only doing this attending to the products of conception. Okay? All right. All right, now I have several case studies here for you, but we are getting on in time. But I wanted you to just have this to practice with on your own. And yes, the code answers are following. But I want you to practice reading this documentation and looking at the description of the procedure. Okay? And then determining the correct ICD-10 PCS code. If you have any questions, email me. Don't be silly. Don't say, well, why was that code not this code? Why was this not that? Just email me and I'll be happy to explain it to you. Okay? All right. I'm sorry Zoom wasn't having a good day today, but I hope that there was enough recorded here that you were able to absorb some knowledge. Okay? And seriously, I love it when students ask questions, so don't hesitate. I will post this recording and have a great day.